This medication is a mixture of aspirin, acetaminophen, and caffeine. It is used to temporarily alleviate pain from conditions like muscle aches, toothaches, menstrual cramps, or headaches, including migraine. Aspirin and acetaminophen work by preventing your body from producing certain natural substances that cause pain. Caffeine helps enhance the effects of aspirin and acetaminophen. It is important to follow the recommended daily dosage and take this medication at the optimal timing to achieve the best results. If you are taking the over-the-counter product to self-treat, make sure to read all the directions on the product package before taking this medication. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. Take this medication by mouth as directed by your doctor, or follow the product package directions. Drink a full glass of water, 8 ounces/240 milliliters, with this medication unless your doctor directs you otherwise. If you are using the tablet form of this medication, do not lie down for at least 10 minutes after you have taken this drug. If upset stomach occurs, you may take it with food or milk. The dosage is based on your medical condition and response to treatment. Do not increase your dose or use this drug more often or for longer than directed. Do not use this product for pain lasting longer than 10 days or fever lasting more than 3 days. Use the smallest effective dose. If you are taking this drug as needed, remember that pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. If you are taking this product for headache, get medical help right away. If you also have trouble speaking, weakness on one side of the body, sudden vision changes. Before using this product, consult a doctor or pharmacist. If you have daily headaches, your first headache after age 50, a headache that is more severe or different from your usual headaches, headaches caused by head injury, coughing or bending, a headache with vomiting, fever and stiff neck. Consult your doctor or pharmacist if your migraine headache is not relieved, or if it worsens after the first dose. If you are using drugs for migraine attacks on 10 or more days each month, the drugs may actually make your headaches worse. Medication overuse headache. Do not use medications more often or for longer than directed. Tell your doctor if you need to use this medication more often, or if the medication is not working as well, or if your headaches get worse. Consult your doctor if your condition lasts or gets worse, for example, if you have new or unusual symptoms, redness or swelling of the painful area, pain or fever that does not go away or gets worse. Some common side effects of Pain Reliever Plus include nausea, vomiting, stomach upset, trouble falling asleep, or a shaky/nervous feeling. If any of these effects persist or worsen, notify your doctor or pharmacist. If your doctor has prescribed this medication, it's because they believe the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, stop taking this medication and contact your doctor immediately if you experience severe stomach/abdominal pain, severe dizziness, fainting, vomit that looks like coffee grounds, black/bloody stools, ringing in the ears, loss of hearing, irregular/fast heartbeat, signs of kidney problems, or easy bruising/bleeding. While very serious allergic reactions to this drug are rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including fever, swollen lymph nodes, rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you experience any other effects, contact your doctor or pharmacist. Remember to consult your doctor about the appropriate daily dosage and the best time to take this medication. Acetaminophen is an ingredient in Pain Reliever Plus. Taking too much acetaminophen can cause serious liver disease. Adults should not take more than 4,000 milligrams, 4 grams, of acetaminophen a day. People with liver problems and children should take less acetaminophen. It's important to ask your doctor or pharmacist how much acetaminophen is safe to take. Do not use Pain Reliever Plus with any other drug containing acetaminophen without asking your doctor or pharmacist first. Acetaminophen is found in many non-prescription and prescription medications, so it's important to check the labels on all your medicines and ask your pharmacist if you are unsure. If you take too much acetaminophen, overdose, seek medical help right away, even if you feel well. Overdose symptoms may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. Daily alcohol use, especially when combined with acetaminophen, may damage your liver. It's best to avoid alcohol while taking Pain Reliever Plus. Before taking Pain Reliever Plus, make sure to inform your doctor or pharmacist if you have any allergies to it or to other medications. It's important to discuss your medical history, especially if you have asthma, blood disorders, ulcers, kidney or liver disease, heart conditions, high blood pressure, or stomach problems. If you are an older adult, you may be more sensitive to the side effects of this drug, and it's important to avoid alcohol and tobacco while taking this medication. Children and teenagers under 18 should not use aspirin or aspirin-related medications without consulting a doctor. Women who are pregnant or breastfeeding should also talk to their doctor before using this medication. It's important to be aware of potential interactions with other medications when taking Pain Reliever Plus. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are several medications that may interact with Pain Reliever Plus, including acetazolamide, cimetidine, corticosteroids, ketoconazole, methotrexate, mifepristone, certain medications for gout, anti-seizure drugs, and vemurafenib. It's important to consult your doctor before using this product if you have recently received certain live vaccines. This medication may also increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Make sure to check all prescription and non-prescription medicine labels carefully, as many contain pain relievers and, if taken together with this product, may increase your risk for side effects. It's also important to note that this medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors are aware that you use this drug. If someone has taken too much Pain Reliever Plus and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. For Canadian residents, contact a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, burning pain in the throat and stomach, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, ringing in the ears, rapid/shallow breathing, irregular/fast heartbeat, change in the amount of urine, dark urine, confusion, agitation, seizures, and loss of consciousness. When taking Pain Reliever Plus, it is important not to share this medication with others. If you use this medication regularly for a long time or at high doses, you may need to undergo lab and/or medical tests, such as liver/kidney function tests. It is important to keep all medical and lab appointments and consult your doctor for more details. Since this product contains caffeine, it is best to avoid taking it close to bedtime to avoid trouble falling asleep. It is also important to limit the use of caffeine-containing medications, foods, or beverages while taking this product. Consuming too much caffeine may lead to nervousness, irritability, trouble sleeping, or a fast heartbeat. If you are taking this product for headaches, it is recommended to avoid certain foods that may trigger your headaches. Making lifestyle changes such as participating in stress reduction programs, exercising, and making dietary changes may also help prevent headaches. It is important to talk to your doctor or pharmacist about lifestyle changes that might benefit you. If you forget to take this medication at the usual time, take it as soon as you remember. If it's close to the time of your next dose, then just wait and take the next dose as scheduled. Don't take a double dose to make up for the missed one. It's important to store Pain Reliever Plus at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and in a place that is not easily accessible to children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.